Good evening and welcome to our COVID-19 update program at this hour. I am Ladi Akeredoluale. Here are the highlights. Federal government to discuss reduced data rates with telecom companies, particularly for students on e-learning platforms. Authorities identified differences between COVID-19 and malaria, say one is more dangerous than the other. And New York City's lockdown extended to May 28th as authorities warned the U.S. to prepare for its darkest winter in modern history. The COVID-19 pandemic is putting enormous strain on health systems around the world. In some countries, that means resources are being diverted from other treatments. Patients with illnesses such as HIV, tuberculosis, or malaria risk having their treatments interrupted. A joint study by the World Health Organization and the Joint United Nations Program on HIV and AIDS says deaths from HIV-related illnesses could double in sub-Saharan Africa if therapies are disrupted for 6 months. The question is, what should be done to ensure health services don't neglect other critical diseases? That's our focus tonight on the program. But before that, here are some of the things that happened during the course of today relating to COVID-19. The Presidential Task Force on COVID-19 says it will open a discussion with the telecommunications companies on the reduction of data rates. The chairman of the task force and secretary to the government of the Federation, Mr. Boss Mustafa, was speaking today at the PTF media briefing in Abuja. Mr. Mustafa told the briefing that because e-learning platforms are now being heavily used to teach various categories of students, it will be important to try to seek a reduction in data prices to make them more affordable, particularly to the students.
Service providers through NCC to appeal to them that now that students are availing themselves with the processes of e-based learning, they should consider as part of their own corporate social responsibility too to lower the charges on data. That would go out, we will talk to NCC and by extension the Minister for Communications and Digital Economy so that we can have that done.
There are marked differences between COVID-19 and malaria, and that's according to the coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu. Dr. Aliyu says the differences can be noticed both in presentation and the effect of both on others. The BTF chairman, Boss Mustafa, also weighed in with his own interpretation of the differences. Both men spoke at today's media briefing.
Okay, one is a parasite, one is a virus. But of course, if you're talking about the symptoms can be very similar. The commonest cause of fever remains malaria in the tropics. It's not COVID infection.
My simple understanding is that they have explained it in the medical terminology, but my own, the simple one that I understand, one is infectious, the other one is not. Because I can live in the same room with somebody that has malaria, but I can't live in the same room with somebody that is infected for fear of being infected. But with malaria, you can even share a bed with somebody that has malaria. So I think I'm simplifying it so that the listeners at home would understand that there is a clear difference between COVID-19 and malaria. Some of the sicknesses mimic and portray the same symptoms. So the cure of those symptoms should not be assumed as if it is the cure for the virus.
The case involving the woman who is at the center of a testing controversy from Benue State may now be nearing a resolution. That's because, according to the Minister of Health, Dr. Osage Ehanire, she has accepted and allowed a sample to be taken from her for testing. The result is being awaited. Dr. Ehanire spoke about this latest development in the case involving Mrs. Susan Idoko Ni-Okwe, who had before now claimed that she was being held against her will, first by the Benue State government and then by the federal government over her alleged COVID-19 status.
we have been able to persuade the popularly known Benue lady to allow a test sample to be taken to our laboratory for testing. The result is being awaited any time now and will be given to her in person. Please note that while the patient may disclose their result by themselves, the Federal Ministry of Health cannot and will not do so, except it has the permission of the person concerned.
Meanwhile, the case has generated a great deal of controversy involving the federal and Benue state governments, which Mrs. Idoko identifies as being responsible for her situation. Our next report takes a look back at how this story unfolded.
On Saturday, March 28, 2020, Governor Samuel Ortom, in company of the Benue State Action Committee on COVID-19, addressed journalists in Makurdi, confirming the first case of coronavirus in the state. Governor Ortom identified her as Susan Okbe, but offers an explanation as to why her identity was disclosed.
We have confirmed a case of coronavirus being positive on one of our sisters who is already in hospital and was identified by this committee as one of the 8 people that came from areas that are prone with this virus. We decided to call her name Susan Okwe for people who came in contact with her in the last 14 days.
The State Action Committee, headed by Mr. Benson Abuno, claimed that it took them 7 hours of negotiations with Susan Idoko before she agreed to be moved to the State Isolation Center at the Benue State University Teaching Hospital, Makurdi, on March 28, 2020.
I just had somebody come in to check just now.
While at the facility, she released her first video, which went viral on social media, alleging inhuman treatment by the medical team.
Threw this on my table that I should come and pick it and wear it. I asked him for an ID. He said he's a doctor that works with the government. I said he must identify himself to be able to treat me if at all he wants to treat me. And he said he doesn't have one.
Social media platforms went abuzz with the controversy that the patient was upset about the government throwing her under the bus. After 5 days in isolation and upon her request, she was moved to Abuja on Thursday, April the 2nd. On the 7th day of her isolation in Abuja, Mrs. Idoko again made another video asking the federal government to release her.
I am pleading with everybody to please tell Nigerian government to let me go.
Responding to questions at the Presidential Task Force on COVID-19 briefing on May the 7th, the Minister of Health says another test will be conducted on her after the second test came back positive.
She has agreed to be tested, and then she also, as far as her be found, gave conditions for being tested that she must be giving all her results, which is okay.
The narrative soon changed on May the 12th, when the minister disclosed that Mrs. Idoko had again set new conditions and rejected her sample collection by the NCDC.
When NCDC got there, she told them that she wanted the test to be taken by World Health Organization. And then that the test should not be done in Nigeria, they should send it to UK.
Till date, Idoko has posted about 4 videos online claiming she has been incarcerated for nearly 2 months, despite allegations that she has refused to cooperate with the officials charged with managing her condition. While the controversy unfolds, she is threatening to take legal action against the authorities.
Well, one of the authorities that Mrs. Idoko has blamed for her situation is the Benue state government. And joining us from Makurdi, the capital of Benue State, is the chairman of the Benue State Action Committee on COVID-19, who is also the deputy governor Mr. Benson Abono. Good evening, Mr. Abono. Thank you for your time.
Thank you very much. Good evening.
Benue State seems to have been drawn out of this now because it is a federal responsibility. Mrs. Idoko has been moved to Abuja and she's now under federal care. So what was Benue State's role in all of this? Why did Benue State come into the picture at all?
I am really taken aback as to why Benue State is being blamed by Mrs. Idoko in her ordeal. But before I explain, and I would really want to clear the issues, let me say one or two things about myself. I'm a Knight of John Wesley in the Methodist Church, Nigeria. I am an engineer by training, and that makes me an exact scientist, and we don't lie. I am from the same constituency with Mrs. Idoko. She is Idoma, and I'm Idoma. And even though in my office I'm supposed to be fair to all Benue people and indeed all Nigerians, I have a political, it is incumbent upon me politically to defend Mrs. Idoko should her rights be infringed upon. Finally, I am my immediate predecessor in office, the man I took over from, is Mrs. Idoko's elder brother, with whom I am very close. And I will do everything possible to protect him, and indeed will not want any harm to come the way of any member of his family. And so everything I'm going to talk about now is the truth, the whole truth, and nothing but the truth. Now, on Tuesday, the 24th of March, I took over as the chairman of COVID-19 in Benue State Action Committee. On Wednesday, the 25th, I was being briefed about all the issues concerning COVID-19 infection in Benue State. And it was during this briefing that I was made to understand that there were two cases that people were suspecting of being infected by COVID-19. One of them is Mrs. Idoko. And as going by the protocol of NCDC, I gave instruction that her sample and the sample of one other young man be taken and sent to Abuja. On Thursday, the 26th, her sample and the sample of the young man were taken and sent to Abuja. On Saturday, the 28th, the results came. The young man was negative and Mrs. Idoko was positive. Now, it took 7 hours, as you said earlier on, in negotiation with her. I didn't just stop there. I got the elder brother who was who is the immediate past deputy governor of Benue State to cancel her. And she was on the phone with her 3 times. I got another brother of hers, a vet doctor, to discuss with her, to talk to her, to plead with her. Then finally, at about 7 o'clock in the evening, I went over to the hospital that she reported herself into, and from where we were made to understand she had just come from the UK and she was exhibiting some symptoms which were related to COVID-19. And so at the end of the day, I was with her for 24 minutes in the presence of her younger sister who works in a bank in Makurdi. And I pleaded and pleaded and pleaded. And I called the elder brother again to talk to her even while I was there. And it was only then she was convinced and she willingly went into our isolation center at the Benue State University Teaching Hospital. I told her on that day that to me as a layman, she was looking fairly okay. I asked the doctor came down because she was saying she never saw the result. And I said, look, it was unfair for her not to see the result. So I asked the doctor to bring the result. The doctor brought the result, and I asked her, showed it to her, and I asked her if she had seen this result. She said yes, she had seen the result, but she did not agree with the result because she was not feeling unwell. This was what she said. It is not true if she says she never saw that result because I was there when the result was shown to her. At the end of the day, I told her that on Monday I was going to come myself to make sure that her sample was taken again because I asked the doctor, and the doctor said her temperature had come down to normal the previous day, and she was not coughing. So as a layman, I felt she was fairly okay. On Monday morning, I went there myself at 10 o'clock. And the first day I was in the corridor, she came to the threshold of the door, and I was discussing with her because she refused to be attended to by the medical team. And the moment she saw me, she started insulting me. She said I was a liar. I said I was going to come on Sunday. I didn't come. And I told her, no, I didn't say I was coming on Sunday because Sunday was not a working day. And on Monday, it was Monday I told her I was going to come. And I came on Monday. And I pleaded with her for her sample to be taken so that we'll send it to Abuja. And she refused.
Deputy Governor, I'm sorry, because of our time, this part of the story of how it is, because the controversy has also, of course, moved on to Abuja. So my next question, by way of this discussion to round it up, would be to ask you, now that the health minister, the federal health minister, has confirmed that they're going to redo the tests. She has given the sample, they're going to redo the tests, and they are waiting the results because she has given the sample. Does this now lay this seeming controversy to rest for Benue State and for the Benue State government?
I'm very sorry, but let me say this. By today, according to Mrs. Susan, she had been in isolation center for 51 days. Of these 51 days, she spent only 5 days in our isolation center. And so whatever happened, I don't know why it is Benue's fault. Benue has no testing center. Benue didn't test her. It was the NCDC that tested her and found her to be positive. When she insisted she didn't want to be treated in Makurdi, I made a request by text message to the Honorable Minister of Health. The Honorable Minister of Health replied, and I discussed with him. He spoke with her 2 days consecutively. And when she insisted she wanted to be moved to Abuja, I requested the Honorable Minister to do so. And that was why she was moved on the 2nd of April after 5 nights in our isolation. And since then, she has been in isolation center at the National Hospital in Abuja. So for God's sake, where is the fault of Benue State? Anyway, all I know is that since the 2nd of April,
the Deputy Governor Abono, our time is completely spent. We're going to have to leave it there. The point is that, of course, Benue State now feels that it is out of this and it is now a federal government issue. Thank you so much for your time. Mr. Benson Abono, Chairman of the Benue State Action Committee on COVID-19, joining us from Makurdi, the Benue State capital. Now, with so much focus on COVID-19, this next report takes a look at how the response to other diseases are being handled by health officials and how patients suffering from other ailments have fared since coronavirus hit Nigeria in late February this year. Figures from the NCDC put the death toll from Lassa fever as of May 2020 at 187, which is higher than the deaths recorded so far for COVID-19. Our correspondent, Kayla Megwa, reports.
Since COVID-19 pandemic spread to Nigeria, it's as if other diseases disappeared in the country. But this is not true. According to the NCDC, in 2020, deaths from Lassa fever totals 187. Cholera has recorded 45 deaths, and measles 52 deaths. Health workers admit there's a reduction in the focus on other diseases, both from healthcare facilities and from patients.
Possibility of you going to see a doctor, you can actually contract the coronavirus in hospital. So patients feel, well, let me stay at home. Under normal circumstances, you go to OPDs, you go to SOPDs, you see large numbers of patients on appointments. Now, those appointments have to reduce. The reason is because to reduce congestion even within the tertiary institution.
People with pre-existing conditions are more prone to COVID-19 infection. The problem is, they must frequent the hospital because of these pre-existing conditions. Lucy Enya heads the Society of Women and Children Living with HIV and AIDS. She's been living with HIV now for 25 years, and this center empowers over 30 people living with the disease. She says the COVID-19 pandemic has worsened their conditions.
A lot of our members are having problem of picking up their drugs because of transportation. The transportation is so high now because the taxi will say you just 2 people in a taxi or 3 people in a taxi. So you can see affordability becomes a problem. It's like a war, to us having HIV virus, and then you are also facing another pandemic. So it's a problem facing these two things.
Lucy is one of the lucky ones. There's an entire demographic of people living with HIV and AIDS who are at a higher risk of being infected with COVID-19.
Those ones that don't know their status, and if unfortunately the virus is hacking their immune system rapid and fast, and it has eaten up the body defense mechanism to a certain level where it is just about to give up, we don't know how they are going to fare with COVID.
No doubt, COVID-19 presents a plethora of issues, especially in the health sector. What's important is that each issue gets sorted out in the shortest possible time. As stated by the World Health Organization, while we work together to aggressively tackle the coronavirus, we must ensure other killer diseases are not neglected by health officials.
We'll take a break at this point. When we come back, we'll talk a bit more about the fate of other ailments in the COVID-19 era. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Kayla Megwa, whose report you saw just before we took the break, joins me now from our Abuja studios with a bit more. Good evening, Kayla. So, the other things that were harming and dealing with Nigerians by way of illnesses have not gone away simply because COVID is here. They've just kind of been subsumed.
Absolutely, Laddie. Good evening. Now, what we found out today is that the healthcare system in Nigeria is being hit by a very strange phenomenon, which is coming from patients and medical personnel as well. From patients, I can tell you for free that a lot of people right now would not go to the hospital because they would be scared that whatever symptoms they show might lead people to think that they have COVID-19 and they might have to go into isolation centers and whatnot. So there's that fear. So the way people assess medical help these days is actually very different. There's a lot of self-medication going on. We spoke at length with the doctor in that interview. There's a lot of self-medication going on right now because many people know that, most times you go to the hospital if you have a fever. Now, if you have a fever and you go to the hospital, most likely that they'll start to think you have COVID-19. And many people are scared. They're not quite sure about how the system works, and they don't trust the system very much. So a lot of people are keeping their illnesses to themselves. There's also the fear that you might get infected in hospitals, which is what that doctor was talking about. Some people feel, look, when people get COVID-19, they definitely go into a hospital to go get themselves checked out. I don't want to get infected, so many people are staying at home. Now, what that does to people with pre-existing conditions is that it's a double fear for them because this disease attacks people with pre-existing conditions like HIV and AIDS, tuberculosis, diabetes. So people who have these pre-existing conditions these days are not going to the hospital. They're not going as frequently as they should. And the medical system in Nigeria is trying to adjust to something that many medical systems across the world have adjusted to, which is telemedicine. That's what they called it. You basically call the person. You're able to show your symptoms to your doctor via your phone and they're able to diagnose. So those are things that are beginning to happen in Nigeria in a way of adapting to the situation we find ourselves in. But that is the truth, Laddie.
I must ask you, though, Kayla, the other things that were mentioned in your report, and indeed in other reports that we have, some of the really big ailments that had been around before COVID, things like tuberculosis, like HIV, and like malaria, therefore are still very much with us, right? Because there are some who tend to believe that COVID-19 seems to have swept all this away.
They have not gone anywhere. In fact, the number for Lassa fever is more than the number of people who have died from Lassa fever. It's higher than the number of people who have died from COVID-19. So these diseases are still out there. And many people may have forgotten about them and focused on this one. Well, understandably so, Laddie, because this one has no cure. We're still trying to understand it. There are a lot of things that are not clear about it. But it's important for people to know. In fact, the NACA DG said this is the time. This is the time for you to check your HIV status, because many people who have HIV and have not tested themselves, do not know their status, are more prone to catching COVID-19. In fact, he says we don't know how they would respond to COVID-19. So people, while we're trying to, stay healthy, stay positive, stay COVID-19 free, have to also make sure that they don't get themselves infected with other diseases and then find themselves in a situation where they're afraid of going to the hospital because they don't want to go into isolation centers for having symptoms that look like COVID-19. So yes, it's important for people to know that these diseases are still there and everybody needs to be careful, Ladi.
Thank you so much, Kayla, and do continue to stay safe out there. Our correspondent, Kayla McGuire, joins us from our Abuja studios. To take a deeper look at this, I'm also being joined from the same Abuja studios by a virologist who is also a public health epidemiologist and a member of the West African Network for Tuberculosis, AIDS, and Malaria, Dr. Ekala Ishaku. Dr. Ishaku, thank you once more for coming in. Thank you for your time.
Good evening, Ladi. Thank you, viewers.
The background that Kayla has set is to indicate that many of these diseases, but if we just take the big three that are in the committee that you are on, which is tuberculosis, HIV and AIDS, and then malaria, that they are still wreaking havoc as much as anything else, even though COVID-19 is what is in the news.
Absolutely, Ladi. I support Kayla's report, and I want to say that when you have the national outlook, you will discover that malaria, TB, and HIV and AIDS accounts for 60% of outpatient visits and 30% of hospital admission. So I agree with you. The issue, so that brings to the national question. Have we neglected other diseases to focus on COVID-19? Why is it that malaria has not gotten the response that COVID-19 got? Why is it that HIV and AIDS and tuberculosis have not gotten the response that COVID-19 has gotten? So I think we need to have a national discourse. We need to come together to fine-tune and to be able to have a unified policy that will have a holistic approach and response to all these infectious diseases. Ladi, we have not talked about Lassa fever. We have not talked about influenza virus. We have not talked about even diarrhea diseases. We have not talked about cholera and the rest. So my take here is this, is that we need to bring in stakeholders. We need to bring partners together and be able to come up with a national unified policy on how we can be able to holistically tackle these infectious diseases. My take, I have written an expert opinion paper note to the National Technical Working Committee. One of the submissions I made is that we must begin to think on how we can come up with a contingency plan to begin to navigate around all these things. So I agree with Kayla's report. It is quite valid, and it has actually given a national outlook of the crisis we are in.
At this point, let me point out here, yesterday the Minister of Health, Dr. Henry, did say that the latest statistics from the National Health Management Information System says that outpatient hospital visits have dropped by 50%, 4 million to 2 million. Antenatal visits by about the same percentage, and skilled birth attendants have dropped by almost the same thing, while immunization services have also dropped by about half. So when we are through with dealing with COVID, hopefully, these other problems, is it possible that they would have become even bigger?
Actually, Ladi, we are going to experience a lot of health crises. We are going to experience issues of drug resistance as a result of HIV and AIDS. We are going to also have multiple drug resistance as a result of relapse cases of TB. We are also going to have high mortality rate as a result of malaria. So what I want our nation to do is to come up with a Nigerian model. We should be able to do what is called personalized health therapy. Ladi, I was I led a state response rapid team to one of the states in the north-central Nigeria. And I can tell you that one of the three of their tertiary healthcare institution was converted to an isolation center. And basically, those are HIV and tuberculosis clinic. So my take here is this, that we can begin to see how we can begin to deliver most of these essential services to these patients, even at home. Ladi, what stops us from using our Nigerian postal services in delivering of drugs to patients if we have their database? Ladi, what stops us from even having a feedback or collecting samples from these patients in their places and then return it back for them to be tested? What also stops us from also setting up what is called the community COVID-19 Corp Marshal? So we must begin to strengthen our primary healthcare system. So I want to advise the Presidential Task Force to begin to look in this direction. We can actually activate our Nigerian postal services to be delivering these essential services, and then begin to do what is called bottom-top approach. Now, the Presidential Task Force has given a great leadership to this regard. So it is time for us to engage the community. And in engaging the community, we must be able to set up what is called the community COVID-19 Corp Marshal, so that they can be able to interact with people that need these essential services, and then drugs and other services can be delivered to them. I think that is the way to go. We need to also come up with our own Nigeria model. And I think we need to also shift from the copy and paste approach model and then begin to have our model as a nation. So this is my take on this. We must be able to
Thank you very much, Dr. Ishaku. I'm sorry, we've completely run out. We've run out of our time. I wish we had more time for this. But Dr. Ekala Ishaku, thank you so much for these prescriptions. Dr. Ishaku joined us from our Abuja studios. With 193 new cases posted on the website of the NCDC, that's the Nigeria Center for Disease Control, within the last 24 hours, the total confirmed COVID-19 cases in the country has crossed the 5,000 mark, standing at 5,162. It also puts the number of patients discharged at 1,180, deaths at 167, and number of active cases at 3,815. The figures by region show that Lagos in the southwest still has the highest figure in the country with 2,099 cases, followed by Kano in the northwest with 753 cases. The FCT in the north central comes next with 379 cases, and Bauchi still leads in the northeast with 207 cases. Edo State in the south-south has 92 cases, and Enugu in the southeast has 12 confirmed cases. And it's cheering news from Niger State as the government announces that it will start testing for COVID-19 in the state in 2 weeks. Governor Abubakar Bello discussed this at the government house in Minna while giving an update on the progress being made in the fight against the pandemic. Our correspondent, Emperor Simon, gives us more.
A total of 202 samples have been taken by the Niger State government to the Nigeria Center for Disease Control for testing, out of which 135 results have returned and 67 results are still being waited for. This is a source of concern for Governor Abubakar Bello, as it says the slow return of results from the Nigeria Center for Disease Control is slowing the efforts of the state government towards ascertaining its status. The governor wants the testing center to be established and is optimistic that in the next 2 weeks it will begin operation.
Government has reinforced the following strategies. One, we are at an advanced stage of establishing a molecular laboratory at the General Hospital Minna to increase our testing capacity and reduce the turnaround time for the release of results. The government is in its final stage of establishing a test center, and hopefully in the next 2 weeks testing will commence in the state.
But what do the citizens in Niger State think about this move by the state government? Earlier in the day we spoke with some of them, and these are the opinions we get.
Yeah, it's a very good decision because in Nigeria in a whole, we are finding it difficult to believe about this coronavirus and all. So it's a good thing for Niger State to start testing about coronavirus.
In fact, I cherish and admire the effort so far made by the Niger State government in respect of this COVID-19. And it's a welcome development, quite all right.
At the moment, Niger State has a total of 10 confirmed cases of COVID-19. If the testing center comes into operation, it means more cases of COVID-19 may begin to emerge. From Mina, Emperor Simon.
Thank you, Emperor. Let's cross over to Lincolnshire in London in the United Kingdom, where a consultant obstetrician and gynecologist, who is also the president of the Medical Association of Nigerians across Great Britain, Dr. Ibrahim Bolaji, joins us to tell us how far that country's health system is managing people with ailments other than COVID-19. Good evening, Dr. Bolaji, and thank you for your time this evening.
Good evening, and thank you very much indeed for bringing me to the channels.
Now, how is the UK health system dealing with those who have ailments other than COVID-19? Are they still receiving maximum attention, superior care, and all whatever it is that they were receiving before COVID-19 came along?
As you'll expect, this is not going to happen because prior to the lockdown, all the hospital activities have stopped. But there's going to be a recovery process which started last week. And this recovery process will involve looking at the very minor cases to be operated on. There is no activity in the hospital at the moment. Most of the activities are around COVID. In addition to that, not many patients are quite happy to come to the hospitals. The footfall in the accident and emergency has been dramatically reduced. The elective activities in various parts of the hospitals have been dramatically reduced. All the elective procedures, surgical procedures have been reduced. The only activities that are going on are mainly cases of telephone consultation. But for the antenatal patients, you cannot but see them with a lot of help with the PPE. The situation now currently in the UK, today the death toll has increased to about 34,000. We are now the highest in Europe. The R value, 0.7 to 0.1, after 2 days of lockdown. The death toll involves the healthcare professionals has also increased to about 200. And surprisingly, more than 70% of these mortalities involving the healthcare professionals are from the ethnic minority group. This is a bit worrying. We have written to the government about this to look into possible causes of it. For example, if in Nigeria, you're a black man, you have about 4 to 5%, 4 to 5 times the possibility of dying from coronavirus compared to the white minority. The other ethnic minorities involved are the Pakistanis and Asians. For example, Bangladesh hospital fatalities are about twice that of the white. Pakistani hospital fatalities about 2.9, but Black African about 3.7, as high as 3.7 over the white. We're not quite sure what is going on.
I'm sorry to interrupt. Dr. Bolaji, but are people taking, I mean, some of the stats that you're giving are quite startling, but is this in any way affecting the resolve of these various groupings in making themselves available as healthcare professionals, since quite the number of their compatriots are contracting this virus, and the statistics you give indicate that paying the supreme price in some instances?
Yeah. There's been a lot of activities around the place to support one another. We are healthcare professionals. We have an oath to look after our patients. Majority of us, we don't really have a choice. Our first resolve would be to look after the patients. If we don't, who else will? But what we've done as organizations and other BME organizations is to ensure that we push government to ensure that we have protective equipment for all our members. The public inquiry is about to start because the government has been forced to set up a panel, and that panel has been headed by an African, a West Indian professor, Professor Kevin Fenton, but we still don't know precisely what the terms of reference would be, and we don't even know the time scale. But we want that investigation and inquiry to start now, because many of our people are dying, and we really need to know why. There's been a number of reasons that have been explained. For example, cultural and genetic factors. Certain Asian populations suffer from metabolic syndrome. And of course, there's a high level of social deprivation. But that is not going to explain the reason why many of the African senior doctors are dying, because they are in the high social class of the society.
Now, allow me to ask that, given the fact, earlier on in your statement, you did mention antenatal visits and the fact that really you're still seeing quite a number of those. Our experience here in Nigeria is that those numbers have dropped by about 50% or more in many instances, because, as you pointed out, a lot of people are afraid to show up in the hospital for varying reasons. Are there lessons that, in spite of the imperfections you've mentioned, Nigeria can take from the UK?
Yeah, well, the main important thing is to reduce the footfall. What is responsible for high population of people visiting the antenatal clinic is the number of people that accompany them to the hospital. There is an opportunity for community midwifery to take a chunk of this, because you don't really want to bring many people to the hospitals, rightly so. You just want to bring those that are required hospital visitation, or the need to see a senior consultant to come to the hospital. Majority of all these cases could be dealt with in the community. And what the communities are doing, they've divided themselves into two groups. Those cases that can be easily dealt with telephone conversation, and those that might require the visit by the community midwife. So they're triaged. And every week, a group of midwives will go around the local community to pay visits. And there are community centers where patients can come to, but a small proportion that come to the hospital, they are spaced out in such a way, because the preparation to get ready to examine this patient, you need to put on your PPE. And after you've examined the patient, you have to remove the PPE, clean the environment. And so we are taking 3 times as more time per patient. But you're absolutely correct. The number of footfall has reduced dramatically, and we are only seeing those that require urgent attention.
Dr. Ibrahim Bolaji, thank you so very much for your time today. It's been a pleasure having you on the program. Dr. Bolaji joins us from Lincolnshire, London, in the United Kingdom. We'll take a break. When we come back, we'll look at what's happening in 1 or 2 other spheres around the world. Thank you for staying tuned. New York City's lockdown has been extended until the 20th of May at the earliest. New York State Governor Andrew Cuomo announced the extension while easing the shutdown in other parts of the state. Health experts have warned the United States to brace up for the darkest winter in modern history.
Americans yearn to get back to work, to open their businesses and to provide for their families. I get that. However, what we do must be done carefully with guidance from the best scientific minds. Our window of opportunity is closing. If we fail to improve our response now based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution.
Joining us from Washington, D.C. is our correspondent, Maria Bird. Good evening, Maria. Thanks for your time. What did that health official, Dr. Bright, mean by saying that the darkest winter?
Dr. Bright has been saying, obviously, for some time now, but obviously most people are now hearing from him more than now that he has come before the Senate in the U.S., is that we've never seen anything like this before. He believes that we're going to see another spike and another cycle of COVID-19 come the winter. And so this will be something that he says is unprecedented, that we've never even seen in the history of the United States, which means this will outlast potentially the Spanish flu, which many people have compared COVID-19 to here in the U.S. And so he's telling us to brace ourselves, which is why you're seeing many larger governmental organizations and schools being very cautious about potentially opening back up before next year.
This is presumably also why New York is being careful with the extent with relaxing the lockdown in New York City itself.
Of course, 28 states, on a brighter note, have shown a decline in new cases. And so New York wants to be able to reopen and obviously have that same sort of a decline happen when they do open. And again, New York is such a large metropolitan area that if they have to shut down because of an outbreak in the fall and winter, it will have dramatic impacts not only on the state of New York, but on the country as a whole.
We've got just 30 seconds, I'm told, to wind this up, so maybe you can answer me this in that time. Looking ahead now, are we expecting to see more of those states open?
Yes, in 30 seconds or less, we're definitely going to see states reopen. And the press conference today with President Trump, he says vaccine or no vaccine, the U.S. is reopening. And so we will begin to see getting close to 50 states probably reopening. But whether or not it will be before the fall is the question that we'll all be watching and waiting to see.
Thank you very much, Maria Bird. Came in under 30 seconds from Washington. Thank you very much for your time. And do stay safe.
Thank you.
Now, you can find more information on the coronavirus pandemic on the website of the World Health Organization, including the world body's response to the disease and guidelines on coronavirus prevention. Also, Channels TV's website has more details on COVID-19, including information on the daily briefing by the Presidential Task Force on COVID-19. Do log on to www.channelstv.com. That's our COVID-19 update at this time. Thanks for being with us. I'm Ladi Akiri Duluale. Good night.